Welcome to the Greater Winterhaven Chamber of Commerce Ask the Doctor series. This new series for 2021 is launching in partnership with Baycare and Winterhaven Hospital to give you, the community, an opportunity to learn more about our local physicians, personally and professionally, and to highlight the many important services and programs that Winterhaven Hospital provides to help keep our community healthy and thriving. On this episode, we are honored to welcome Dr. Safi Haq, who specializes in thoracic and cardiovascular surgery here at Winterhaven Hospital's Bostick Heart Center. Welcome to the show, Dr. Haq.
Thank you. Thank you so much for having me.
So tell our viewers a little bit about yourself. Where'd you grow up and where'd you go to school?
So I'm originally from India, but I grew up all over the place. We moved around a lot when I was growing up, but I call Houston home. I went to medical school at the American University of Antigua, and then I moved to Ohio for general surgery residency, where I spent 5 years there in Youngstown, Ohio. And then I went to University of Miami for my cardiothoracic fellowship training, and I spent a few years down there. And then I came straight to Winterhaven thereafter.
Wow, so you really have been all over the place.
Yeah, I didn't even get into it, just in the interest of time. But yeah, I'm a real nomad.
So what's your favorite sports team? I have to ask that question then.
I am a big fan of Houston sports teams. I like the Rockets a lot. The Texans, unfortunately, aren't always as I don't know what the word is. They're not always as kind to their fans, but I'm still a diehard Houston fan.
Well, good. So what made you look, when you were in Miami, what made you look to Winterhaven as a potential option to start?
So for me, it was a multifactorial decision. A big part of it for me was geography. Once I came down to Florida, I was really hard pressed to want to leave. And I was really kind of interested in a very specific type of practice environment and a type of place I could go to where it was very collegial and it felt like a family. And honestly, after a few interviews, once I interviewed here in Winterhaven, I stopped interviewing elsewhere very quickly.
That's wonderful. I'm going to take that soundbite and just use it for anybody thinking about Winterhaven as an option, because I agree with you totally, 100%. Right. So explain to our viewers that may not be familiar, what is the Bostick Heart Center?
So the Bostick Heart Center is a dedicated portion of Winterhaven Hospital that the cardiovascular service line functions out of. And it's an interesting place because it's not just where we have patients in rooms or where we do procedures. It's really kind of I like to think of it as like a one-stop shop for the patient in terms of they can come in the one building that's attached to the hospital. They can see their doctors, whether it's a cardiologist or a surgeon, and they can get their testing done there, whether it's in the way of ultrasound, EKGs, echocardiograms, cardiac catheterizations, nuclear tests, stress tests. And we can provide their treatment there too, whether it's surgery, whether we need to take them down to the operating room or go to the hybrid OR to do something interventional, or they get stents or something placed in one of our cath labs. After that, they're in the same area for their post-operative care or whatever care they need. And we even have rehabilitation services there. So it really is kind of a place that the patients can come to and get everything done that they need at once.
And so what is the role that the structural heart and valve program play at the Bostick Heart Center?
So the structural heart and valve program in that clinic kind of centers its focus on problems related to valves of the heart, whether it's the aortic valve or the mitral valve and certain other issues that may arise, like there's in the left atrial appendage, we can form clots, so we can do procedures to address that. We can have small holes in the septum that separate the chambers of our heart, and we can do procedures to correct all of that. And those are the kind of things that the structural heart and valve program focuses on, as opposed to things like coronary disease and aortic disease and that kind of thing.
And so you kind of mentioned this, but what are the types of diagnoses that the clinic normally treats?
So in the structural heart and valve clinic, primarily we see patients with aortic stenosis, with mitral regurgitation, which are problems related to the valves, like leaky valves or tight valves. And we also see patients that have chronic issues with the rhythms of their heart that can portend to them getting clots in certain parts of their heart, or we see patients with, like I said, small connections between the chambers of the heart.
And what are the different procedures that your team would use to treat patients that are coming in with those diagnoses?
So when we see patients with aortic valve disease, we kind of work as a team to come up with whether surgery is the best answer for them, or we have something that's done, pretty kind of standard throughout the country that's called a transcatheter aortic valve implantation. Some people know it as a TAVR, which is a little bit of a misnomer, but so there's that on the aortic valve side. And then on the mitral valve side, we offer mitral valve surgery in the way of repair and replacement, as well as MitraClip, which is a transcatheter way that we can fix leaky mitral valve.
So for those of us that may not be as familiar with the two procedures, what are they? What is you said the TAVR and the MitraClip?
Okay, so the TAVR it stands for transcatheter aortic valve replacement, and it's a little bit of a misnomer because when we do open surgery, we open the breastbone, we go on the heart-lung machine, we go and we cut out the aortic valve, we take out the old valve, and we sew in a brand new valve. So that's a true replacement. With the transcatheter approach, we use a series of catheters and wires that go through the groin. And we basically leave the old valve in place and we position a new valve inside of it. What that does is it takes all of the pressure off of the main pumping chamber of the heart. Because what happens in patients with aortic stenosis when they have a tight valve is it's basically the heart trying to beat against a closed door. So when we put that new valve in going through the groin, it opens it up and lets the blood flow forward to the rest of the body. The MitraClip is similar in that it's also a transcatheter procedure using wires that go through the groin. But what it does, it basically takes the mitral valve, which is like saloon doors that opens into the main pumping chamber that become leaky, and it basically places a clothespin, a tiny little clothespin on those valves to stop the leak a little.
So you just mentioned two particular types of procedures. What are the benefits of those procedures?
So the benefits of these procedures, both on the aortic valve side and the mitral valve side, are to benefit patients who, for whatever reason, wouldn't either tolerate being on the heart-lung machine for surgery or wouldn't tolerate surgery for some other reason.
And so when you're performing the surgery, are you performing the surgery using a robotic mechanism to do that? Are you?
So when we do normal surgery, we just go down to the operating room and we use our instruments and our hands to do the surgery. This is a little bit different because we work as a team with a surgeon and a cardiologist in the cath lab, or the hybrid OR is what we call it. And we use X-ray to guide the wires up, and we have kind of a roadmap with imaging that we've done beforehand. So we know where we're going and how we need to get there. And we all do it. It's all done under X-ray, basically.
Is the recovery time for a patient, in this case, going through this type of surgery versus traditional type of surgery, does it tend to be shorter, or what is the recovery time like?
It is a little bit shorter in that for our surgeries, when we do them here at Bostick Heart Center, usually our patients with valve disease, when we do a valve replacement, they're usually in the hospital for maybe 4 or 5 days. Whereas with the transcatheter approach, you can go home as soon as the next day.
Oh,
yeah, and the recovery is a little bit different in the way that you don't have to worry about the breastbone healing and that kind of thing. But having said that, there are still patients for whom the correct answer is still to do surgery.
Yes, we have a lot of pride for the Bostick Heart Center in our community. I will tell you that for the number of years that it has been around, the impacts of having those services in a community our size, although we grow exponentially every year. But that means a lot to the patients here, and that they don't have to drive to Orlando or to Tampa or anywhere else to get the services that the Bostick Heart Center offer. And so why is the Bostick Heart Center so advanced?
So I think that there's been a tremendous amount of resources put into the Bostick Heart Center in terms of personnel, in terms of acquiring cutting edge technology for all of the procedures that we need to do. But I truly think what makes the Bostick Heart Center so advanced is that the entire team is dedicated to a multidisciplinary approach. There's very little in the way of unilateral decision making. And I think what that provides the patient is the opportunity to, one, not have to travel, like you were saying, but two, to know that they are receiving the expertise of a number of different people with a different purview. And they're kind of getting what everyone thinks is the best treatment for them, not just the surgeon saying, hey, do surgery and someone else saying, hey, don't do surgery, that kind of thing.
Very good. Well, thank you so much for being a part of our second episode of Ask the Doctor. We really appreciate your time today.
Of course. No, it was a pleasure. Thank you all for having me.
Thank you.